I'm Dr. Nirav Goyal. I'm head of liver transplant and HPB surgery at Indraprastha Apollo Hospital, New Delhi. I'll be talking on hepatitis, which is a scourge which is there present in our society. And this hepatitis may occur from several reasons. And I will take you through the reasons for hepatitis, how to manage it, how to deal with it, and what are the cures and curative treatments available. This clinical course of acute hepatitis, it may vary from asymptomatic to fulminant failure, and the final outcome can be a complete recovery, chronic hepatitis, or cirrhosis. The two main challenges are that there may be progression to fulminant hepatitis, and then there may be progression to chronic hepatitis or cirrhosis. Now, fulminant hepatitis may appear infrequently in 1 to 2% of patients with clinical hepatitis in both type A and type B infections. And nearly 10% of the patients with acute viral hepatitis B develop either chronic hepatitis or cirrhosis. And during the acute phase of the disease, the patients with the later progression to chronicity differs significantly from those with subsequent resolution in a number of serological, biochemical, and morphological variables. The hepatitis A and E virus cause acute hepatitis, and hence they have no effective management. Basically, is symptomatic at around resolving the symptoms of the patient. For hepatitis A and E, a few cases of hepatitis A, that is 0.5%, will develop into severe hepatitis and liver failure. And however, despite symptoms, patients usually have a favorable evolution and the infection is cured without lasting damage. Hepatitis A never develops into a chronic liver disease. Similarly, it is rare for hepatitis E, and these are the two viruses which are more prevalent in India. Hepatitis E being causing more epidemics than hepatitis A. Similarly, it is rare for hepatitis E to produce severe hepatitis. It will produce it in 1% of patients only, with the exception of pregnant women, where the risk of severe hepatitis and liver failure can ascend to as high as 20% of cases. Hepatitis E never becomes chronic in healthy people, but the virus can produce a chronic infection in immunosuppressed individuals, such as in transplanted patients. And we do come across such scenarios. Sometimes becomes difficult to treat, but yes, chronicity can occur in transplant patients. When we talk about hepatitis B, in the case of hepatitis B, the age of acquisition of the infection influences whether it evolves into a chronic condition. 90% of the patients, if shortly after birth, will develop chronicity. As I said, they have to be monitored. 30% of patients, if they are infected between ages of 1 to 5 years of life, then they can develop chronicity. And less than 15% of patients in adulthood, if they get infected, will develop chronicity. So we have to monitor children, particularly when the mother had hepatitis B and there has been a vertical transmission, because 90% of them will remain positive and they will start manifesting in second, third decade of their life. Then when we're talking about hepatitis C, in hepatitis C, the acute infection is usually asymptomatic and very rarely associated with severe hepatitis. In 15 to 45% of the patients infected with hepatitis C, the virus is eliminated spontaneously in the first 6 months following infection. And the rest of this group develops into a chronic infection. And of these, 15 to 30% are at risk of cirrhosis of the liver. And patients with cirrhosis have a 5-year cumulative incidence of hepatocellular carcinoma of 5%. So hepatitis C runs a more virulent course as compared to hepatitis B. Though malignancy, hepatocellular cancer is more common with hepatitis B, but only 15% of the patients with hepatitis B in adulthood will become carrier, whereas and the rest will shed the virus. Whereas in hepatitis C, only 15% to 30% are able to shed the virus, and the rest of them will be developing manifestations of chronic hepatitis C. Thank you.